Good day everyone, I'm Leomy Villena from BSN 1201 and for today I will be applying hot water bag to my patient. So the first thing to do is to check doctor's order because some hospitals requires doctor's order for the procedure to be done. And then assess specific areas for application. And then use alcohol and perform hand hygiene or hand washing to prevent the spread of microorganisms. Next is to gather appropriate equipment. So we have here our hot water, alcohol, our washcloth and the towel, and our improvised hot water bag, which is the Ziploc. And then introduce self and identify the client's identity, and then explain the procedure to alleviate the client's fear and anxiety. And also to promote cooperation with the client and to make sure that we are providing the right procedure to the right patient. So, good day, ma'am.
Good day.
Okay, ma'am, I am Nurse Leia and I will be your nurse for today. May I know your name, ma'am?
Ano may
Okay, ma'am Ella, how can I help you?
masakit po yung puso ko.
Okay, ma'am, so are you in your period right now?
Yes.
Okay, so ma'am, you're experiencing menstrual cramps and I will be applying hot water bag on your lower abdomen area. Okay, ma'am?
Okay.
Okay, and then provide privacy to the client by closing the door or drawing the curtains around the room to provide a safe and private environment to our client. And then the next thing to do is to put the hot water on the Ziploc, on the hot water bag. So fill the hot water bag with 1/2 to 2/3 of hot water with 46 degrees Celsius, and then squeeze the bag and to remove excess water, and then close the bag thoroughly and then place it upside down to search or check to any leakage. And then in our case, we're only improvising, so we have here our Ziploc and our washcloth. So we need to soak our washcloth to our hot water, then do not squeeze it thoroughly, and then place it in our Ziploc bag and then secure and lock the bag. So after that, we need to cover the hot water bag with towel before putting it in contact with the patient's skin. Okay, so ma'am, I will be putting this in your abdominal area. Okay. Okay. So, check the hot water bag for every 5 minutes to check if there's any adverse effect and also to check if the hot water bag is still on place. So, we have to bear in mind that the heat of the hot water bag affected by a lot of factors. So, the first factor is the body parts where the hot water bag is placed, and the second factor is the duration of the application. Okay, if the prescribed duration was achieved, remove the hot water bag from the patient. Okay, so this is to prevent skin burns. So reposition the client and then raise the side rails to provide comfort and safety. And then empty the bag. If you're using a rubber hot water bag, empty the bag, then wash it with soap and water, and then dry it and hang it to prevent the spread of microorganisms to other users. Then in our case, we're using improvised, so we have to remove it. And then we just need to discard the Ziploc bag. Okay, so we're gonna discard it. And then, after that, we need to wash our hands to prevent the spread of microorganisms. Okay, after, evaluate the patient's reaction to the treatment, especially to the area where we place the hot water bag. So, okay, Ma'am Ella, how do you feel right now?
Okay.
So, is there anything else that you need? Any concerns, ma'am? Okay, so ma'am, thank you, ma'am.
Thank you.
Okay, so after that, we need to record the procedure done and then record the procedure done and also the patient's response. So So, okay, so that would be all for applying hot water bag. Thank you.